Welcome to the Plastic Surgery Secrets Talk, a podcast where we go behind the scenes of everything in the plastic surgery and aesthetics world. I'm Dr. Jeffrey Spiegel.
And I'm Dr. O'Neill from the Spiegel Center just outside of Boston. And we are going to talk about FFS and aging faces and all that good stuff with Dr. Ross Clevens out of Florida.
All right. Welcome, Ross.
Thank you for having me.
So if you're watching this on some sort of video instead of listening to the podcast, I'm holding a paper here, which is really embarrassing to the people behind the cameras because even though we've done this many times, I just can't remember that intro. So I'm going to start practicing in the evenings. I know the rest of this stuff. So Dr. Clevens is another one of the elite plastic surgeons, facial plastic surgeons, who's part of Premier Plastic Surgery Partners, our group of the creme de la creme, the star council of plastic surgery, where we get together, share our insights, share our knowledge, and make sure that we have the best of the best with honors.
Yeah.
Of everything that we do.
So last month we had one of your other partners, Dr. Ronan, out of California. And Ross, thank you for coming.
My pleasure. Thank you for having me.
Yeah, it's so exciting.
Tell us about your practice, or tell the people listening in their cars and at home.
Yeah, and this is the time where the table shifts. It was really nice here all summer long. And
now, like September is beautiful.
That's true. September, October. And soon we'll all want to be in Florida.
What do you want to be? We're all going to go to Florida.
So tell us what's hot in Florida in September and going into October and that kind of good stuff.
So our practice, Clevens Face and Body Specialist, is located in Melbourne and Merritt Island, Florida. So that's the space coast of Florida. They are we are the beaches of Orlando, or just about an hour due east of Orlando. It's also known as the Space Coast because that's where all of the space shots go up. SpaceX, Blue Origin's, Kennedy Space Center. So our practice, Clevens Face and Body Specialist, includes myself, a facial plastic surgeon, Dr. Philip Barbie, another facial plastic surgeon, Dr. Andrew McGregor, who is a board-certified breast and body plastic surgeon. We have a cosmetic surgeon in our practice, as well as physician's assistants. So it's a fully integrated plastic surgery, facial plastic surgery in Florida.
We should have had him on in July when Barbie was such a big thing.
I know.
We had our chance.
Yeah.
We have the original Dr. Barbie.
Yeah, Dr. Barbie, I know. That's
and you can be the Barbie doctor. We should have talked about that.
There you go.
All right, well, one of the things that we both do, is facial feminization surgery. How did you get involved in that?
So we saw a number of patients who came to us expressing concerns regarding their gender identity. And as I began facial feminization surgery, of course I'm speaking to the master, perhaps the world's most renowned surgeon in facial feminization surgery. But in many ways I see facial feminization surgery as an extension of facial plastic surgery. We all know that there are certain male versus female aesthetic facial ideals. So in many ways with facial feminization surgery, we're trying to transpose those aesthetic ideals onto our patients and allow them to recognize the gender that they've always identified with.
Absolutely right. And one of the things that we always talk about is that there's synonyms for women looking feminine, looking attractive, looking youthful. They're the same. And this is not just my opinion. This has been shown in study after study. It's science, folks. Science is never wrong.
Right. And then I think also, well, you're like expert into aging faces, right? That's like your big thing. And I think with trans women who are transitioning from male to female, sometimes it happens later on in life and you almost need those years back, right? So you feel like you've missed out on quite a few years where you were presenting to the world something that you're not authentically yourself inside. So you also have to take the clock back.
Absolutely.
Right? So how does it differ someone getting let's say FFS in their youth, and I mean youth, 18, 19, 20, in their 20s, let's say, or under 30, versus someone who does it a little bit later in life, 50s, 60s.
Yeah, or walk us through your analysis process.
Well, no, I mean, as you said earlier, Jeff, I think anything that creates a more youthful, softer appearance is also a feminizing procedure. So in our practice, partly practicing in Central Florida, we see patients of all ages. So I've had trans patients as old as early 70s.
Well,
And
kudos for them for making
living
that,
their life.
living their life.
It's very interesting speaking to a patient who's 72 years old who for their entire life has never felt comfortable in their body. They've not been born with the face that they deserved or that they felt they should have.
That's fascinating.
So what's your favorite feminizing procedure to do?
That's a very interesting question. I feel that the brow, the nose, and the lips are perhaps the most important features in facial feminization surgery. So those are oftentimes areas we might focus upon. But you, again, are the expert.
I agree with that. I think the brow's my favorite procedure because it's so effective. And what I love about it, too, is that it's almost unexpected. I mean, like, nobody looks at another person and says, "You look great. What did you do to your glabellar bone?" Like that's not a thing a person says. People might think about you changed your nose, you changed your this, you changed your that. And it's one of those things that makes almost anybody look better. Certainly, it makes people look more feminine. But if you have a very, very overgrown or significant glabellar bone on a man, it makes them look sinister and threatening.
Right.
And we see plenty of men who come to get that softened, not looking to look like women, just wanting to look like not a dangerous man.
The brow is so complicated because you said you have not only the bony features, but you have the shape and the position of the brows,
That's
the
right.
shape and the level of the hairline. So there are many features that go into the appearance of the
Totally
upper
right.
third
And
of
the
face.
eyebrows are there. I once Googled it. I knew the answer, but I wanted to see what Google said. And I like to ask trainees and other doctors what are the eyebrows for. And if you check it on Google, usually it says to keep water out of your eyes. That's never been like a big use of eyebrows for me.
What do you think the main use
That's an umbrella, by the way. It keeps water out of your eyes. Eyebrows are there to determine your identity. That's what they are there for. They allow a person to see another face at a great distance and determine if they are threatening or familiar, angry, aggressive, happy, sad. And that's why when I'm lecturing to a large group of people, even though I can't see that their eyes are closed and they're sleeping as I'm talking, I can tell from their eyebrows that they're bored. Right? So that's how you can tell from far. And that's what eyebrows are for. And eyebrows are huge in determining your identity. And one more point on this, just to beat it till we're so sick of it, is that the Lone Ranger, Batman, the people in Eyes Wide Shut, when you wear a mask, it doesn't cover your eyes, it covers your eyebrows, and that's what hides your identity.
And
that's why eyebrows are everything in determining our identity. But let's talk now about facelifts, because you have there's more than one kind of facelift, right? So
of course.
Tell me the quickest and the slowest.
The quickest type of facelift to do? Well, the quickest type of facelift to do is probably the facelift that should not be done at all. And that would be the skin-only facelift. And the skin-only facelift is the classic Phyllis Diller facelift where you pull the skin tight and the patient looks windblown, operated upon, and that's what probably shouldn't be done, but it's certainly done lots and lots, and is probably the quickest and easiest to do.
All right. But we shouldn't do them. Well, let's say I've only got like a week before my kid's communion, wedding, something or other, or 2 weeks. What can I do to tighten up my face quick? A week's too little. Give me a month. I'll give you a month.
Well, what can you do to tighten up your face quickly? I mean, there are lots of non-surgical facelift options. So in our practice, we have our express lift, we have our laser-assisted weekend neck lift. These are energy-based procedures that tighten or shrink wrap the skin, melt and contour some of the underlying.
How long does it take to do, and when can I go back to the gym?
The procedures take 45 to 60 minutes to perform, and you can be back to your ordinary activities in 3 to 5 days.
And when can I go to the big wedding?
When can you go to the big wedding? Within a few weeks.
See, that's pretty good.
That is pretty good. Yeah, I like that.
And what about a bigger facelift?
Yeah.
A bigger facelift. Well, a bigger facelift is, as you well know, a more detailed procedure that involves tightening some of the underlying structures of the face, what we call a deep plane facelift, tightening the muscle, repositioning, contouring the fat. That's a procedure that takes 3 to 4 hours to perform. And I find that in my practice, most patients are able to get back to their ordinary day-to-day activities in about 2 weeks or so. As far as the big wedding, 6 to 8 weeks, though.
Okay.
Wow.
That's pretty
Okay,
good.
So there you go. But in Florida, you have a lot of people, probably around where you live, that have a lot of sun damage. So what do you do? Because, I mean, listen, if you were alive in the 80s and 70s and 80s, you put on the baby oil and you sat there with the Pfizers. What's that famous movie that everyone always talk about that?
With the,
Mary,
with aluminum foil.
Something about Mary.
Yeah.
Yeah, something about Mary. We all did that. So what do you do there? Because can you do those procedures because it's sunny in the winter, it's sunny in the summer. When do you do all these procedures?
That's really a great question, Arnir. So an integral portion of rejuvenation of the face, particularly in Florida, we have patients with a lot of sun damage, is some sort of skin resurfacing procedure. Laser skin resurfacing, microneedling, lots of different sorts of resurfacing procedures. And those are procedures that remove lines, wrinkles, blemishes, sun damage, tighten the skin, rejuvenate the skin. Interestingly, in Florida, where the season is warm all year round, we find a lot of patients will choose to have surgery in the summer because that's when it's hot.
That's when they're inside.
That's when they're indoors and air conditioned. That's when their tennis team isn't playing or the golf
So they all
team.
go back up to New York and Boston.
Right. So it's, but it's a year-round activity.
And what's your favorite rejuvenation?
My favorite rejuvenation.
Yeah.
Gee whiz. Facelift is a great procedure. Facelift is the gold standard procedure for rejuvenating the lower 2/3 of the face and neck. So performing facelift is probably my favorite procedure.
All right, last big question. How long does a facelift last?
How long does a facelift last? That's a tough question. I'll give you a few answers to that. I have some colleagues that say that a facelift lasts forever. Last forever means that you always look better having had a facelift. So if you have
Be careful what you say, because that's what I say.
If you have a facelift today, you'll look better 12, 15, 20 years from now.
Then you would have.
I saw a patient of mine a few weeks ago. It was about 12 years out from facelift. She still looked good. She didn't need her facelift redone. She was coming in to have some resurfacing and other rejuvenative procedures for maintenance, exactly.
Aging doesn't stop. Well, you were going to say, though, do you think facelifts last forever or no?
I think in a certain way facelifts last forever because patients always look better having had a facelift.
I was leading the witness. Did you see that?
Leading the witness.
All right. Awesome stuff. So,
and what's your favorite machine? Like as far as rejuvenation that's not surgical?
You know, in my opinion and my experience, nothing beats a form of CO2 laser skin resurfacing. So we do a lot of fractional CO2 laser skin resurfacing. We combine that with facelift.
Well, that's good. So I just have to say one thing. I'm looking at the two of you, and we talked about feminization.
I thought you were going to tell us that we both need facelift.
Well,
she's just.
But I'm looking at the two of you, and I spend a lot of time with the lips, right? I do the fillers and the Botox and all of that, and both of you have really pronounced filtrums, like really pronounced filtrums, and kind of a little bit flat brows.
It makes
like
everybody better looking.
So I just think that that's really interesting because most people, as they age, it just starts to be flatter and flatter. And I know you haven't had fillers, and looking at you, Ross, not having...
I'm just not aging.
Yeah, you're just not aging. There you go. So I think that's also a really important point to bring up because you said it's about lips, it's about brow, and I'm
so
looking
much
at
to
the
talk
two
about
of you.
This.
And this is just the beginning, right? But
very true.
We'll meet again since you guys are now part of the elite group. So there you go.
I've often been told I have a face for podcasts.
Thank you for listening to Plastic Surgery Secrets Talk.
If you like what you heard and you want to get in contact with us, you can call 617-566-3223, email us at info@drspiegel.com, or follow us on social media. That's @Dr. Spiegel.